All right, we're talking back to school today. We got Dr. Kohli and Health Tidbits. Of course, Dr. Kohli, her practice, Cherry Creek Heart. You are a professor. You do all the things. So I love when you come in, especially as we're getting back to school. And I just had my kids go to their annual checkup and get their vaccines. So I want to know, basically, why are the back to school vaccinations so important right now?
Jenny, it's such an important time to make sure our kids are really tucked in with their health because there's this phenomena called September spike, which often happens after the summer. And if you think about what's going on over the summer, it's warm weather. So the respiratory viruses aren't spreading as effectively. Kids are not really getting together as much. So their immune systems get sort of lazy over the summer. So one way to kind of boost their immune system, get it in shape for back to school for those winter months, is to really get them those vaccines. Of course, it also helps to prevent outbreaks or infections that keep our kids at home and keep us out of work. So for those reasons, you have to do the part, not just for yourself, but also just to make sure other kids stay healthy by making sure your kids get vaccinated.
It's not just their immune systems that get lazy. I'll tell you. I try to get a kid up out of bed to go to school. But it's true because I feel like especially because I have elementary and now middle school, it's
great.
They are constantly sick in September. That's usually if they're going to get something, that's the bug that comes home.
Especially the kids that have asthma and allergies, too.
Yeah,
so we tend to see a lot more asthma in September months as well. And so for the kids that have asthma, often a visit to their allergist or their primary care doctor just to talk about inhalers and stuff is important.
Yeah, especially now with all of the wildfires and stuff like that, the smoke in the air.
Yes.
It's already been a little bad. So what shots do kids need to get specifically?
Okay, so you said an elementary school and a middle schooler, right? So elementary school, we sort of think of the basics. You're building up your immune system.
Okay.
So you think about polio, you think about MMR, measles, mumps, rubella. That's really important, especially now that measles is no longer eradicated. It's here to stay, and it's here in our state as well. You want to make sure their tetanus is up to date, and you want to make sure they get something called DTaP, which is the pertussis vaccine as well. Hepatitis is another one that the elementary school. So generally, a trip to the pediatrician will sort of cover everything that they're supposed to cover. For middle schoolers, this is really important. You get a lot of the same vaccines, Tdap and such, hepatitis booster, but it's also important to get the HPV vaccine, the human papillomavirus. And that vaccine works best when it's given before they're sexually active. And this is important not just for girls, but for boys as well, because they can get penile cancer and other types of cancers. And of course, it can be a vector to spread the human papillomavirus that causes cervical cancer. So getting them that vaccination is a really nice thing to do. And then varicella or chicken pox, if they haven't had that as well, that's really important.
Oh, okay. Awesome.
Yeah.
And so older college student kids, what are those ones?
So the big one there is a meningitis vaccine. It's called meningococcal vaccine because they end up in dorms and they end up gathering together. A lot of colleges and universities actually require that for admission, so you have to have proof that you've had it. Now, for all ages, the COVID and flu is really important. And I know this year it's going to be a little bit more controversial because the Health and Human Services Secretary, Robert F. Kennedy Jr., has changed some of the policies around it. So there's still question marks, not just for patients, but even for me as a provider, as to who is really recommended to get it. So I would say it's really important to have a discussion with your child's doctor, pediatrician, and for yourself with your doctor as well, to say, hey, this is my health history. This is who I am. This is my exposure to potential COVID. Should I get it? Personally, I'm going to be getting the flu and COVID vaccines myself this year. I'm probably going to recommend most of my family members to get it as well.
Okay. And so there has been a lot of changes for vaccines. And so where can parents go to get the information to know, specifically what, besides a provider, if they don't do that yet, if they want to kind of get the facts, I guess.
So the CDC is kind of the big umbrella, but I would say for us here locally, the CDPHE, the Colorado Department of Public Health Education, it's a really nice website and a really nice way to get a sense of what's happening in our state.
Okay.
Right? Because a lot of these are infectious diseases, obviously, that we're protecting against with vaccines. So it's important to know what's going on here in order to say, do we really have a high level of measles? Is COVID going up in our wastewater? Are we more worried about certain infections this time of year than others? And so I think that's a really nice thing to do, is to go to the CDPHE website. Like I said, the CDC is always a good resource. And then always going to your doctor. You can never go wrong with that. A quick phone call because they know your personal history and everything. Also, make sure you take your updated vaccine records to the school, because that's really important if there's ever an outbreak in a school or your child might get exposed to a child that has measles, for example. It's important for the school nurse to know how many doses your child has had of that particular vaccine to know whether or not they're at risk, because the kids that are more at risk, you haven't gotten your first dose of vaccine yet because you're an infant and you're in daycare, you could actually get an IVIG to protect you. Or you could get the vaccine after you get exposed to protect you. So it would change what we do. So it's really important to sort of equip the school with all the information about your child's immune system status, basically, so that they know.
Nice. Yeah. All right. So make sure you're checking in, taking that, getting that appointment now, because I know they book out this time of year, like months in advance sometimes. Or check out Cherry Creek Heart and go see Dr. Kohli.